I'm Mariah Pokorny. I'm the Director of Accreditation and Reporting for the South Dakota Department of Health. A typical workday really is never the same for me. I am overseeing several larger projects, such as completing the first ever statewide health improvement plan. I'm finalizing some priority projects for the Public Health Infrastructure and Workforce Grant, as well as creating the foundation for a continuous quality improvement program for the department, all of which takes a lot of creative energy. Another area of my work is focused on advising and supporting the administrators for the Office of Health Statistics and the Office of Vital Records, as well as organizational department support for the 13, soon to be 14, licensing boards, all under the Department of Health, which takes a large portion of my day-to-day work. I've been so blessed during my time at the department to be mentored and supervised by many accomplished and dedicated health professionals, including my current supervisor, Deputy Secretary Lynn Valenti. Every supervisor brings something new to the table, and I really enjoy learning different skill sets and adapting to leadership style changes. I also have a great team of administrators that make my job run so smoothly. I honestly feel like the best thing about the department is the people. DOH was my first state government job, and while opportunities arise to leave public service, the relationships and the coworkers I have is a benefit that no other career could match. This was really tested during the early days of the pandemic response. I was fortunate enough to be able to be asked to participate in the Emergency Operations Center. And the way that we supported and lifted one another up was really so remarkable to experience. We all worked so hard and cared so deeply about the overall health and wellness of the people of South Dakota. Not once in my life did I think that I'd follow any career path into public health. What attracted me to my first DOH job was that fraud and compliance aspect of the Office of Vital Records. Those were the skills that I was most comfortable promoting. But the longer I worked in vitals, I realized how the questions we ask of our medical providers can directly impact the quality of the data that we supply to various programs with focuses on infant mortality, pregnancy monitoring, and cancer prevention. To have a small part in reducing mortality really energized me and helped me grow a focus in public health. How we communicate and support making every South Dakotan healthy and strong takes a lot of skill sets. None of the positions that I've held in the Department of Health have been the traditional or popular jobs one would consider when you think about public health. My passion is organizational support and improvement. How can we collect better data that would help our prevention programs? Or how can we reduce or eliminate barriers for our coworkers to better focus on health? None of these tasks are necessarily on the front line, but they are skills that are so important for a successful public health program. In my prior role as the South Dakota State Registrar, leading the nation's smallest Office of Vital Records to be the very first unit accredited by the Public Health Accreditation Board is a memory that's going to last my whole lifetime. Leaning on coworkers with the same passion and drive is what made us so successful, and I'll never turn down an opportunity to showcase the great work of South Dakota.